For those of you who don't know me, my name is Swati, and I do these videos to bring about awareness on the different aches and pains that you have in your body and easy and simple solutions to manage these pains. Okay, so we're going to talk about knee pain today. So, what is the source of your knee pain? In order to understand this, let's understand a little bit about the knee joint. So I'm not going to go into details of anatomy here. However, understand that knee is a very complex joint and it is one of the largest joints in the body. It has three long bones, so one for your thigh bone and two in the legs. And you have lots of ligaments in there, meniscus, cartilage, lots of muscles that interact with each other around the area. And your knee can actually influence the joint above and joint below, as is the rule with our body anyways, which means any problems at the knee joint will influence your hip and your ankle as well. So some of you who've had long-standing knee pain may have realized that you started having issues around your hip, more so in your hip than in your ankle. Okay. So the knee is also very important because it has your balance receptors. So what that means in simple English is that they have some receptors. Okay, what these are basically is nerve endings that are present in the knees. So the nerves that run from your knees into your brain and then back from the brain into your knees. So they tell you about they tell the brain about what is your balance status. For example, if I'm falling forwards, the balance receptors will send that signal up to the brain, and the brain will activate the required muscles and then pull me back. Okay, so that I do not fall. Works some of the times, some of the time it doesn't, but then it is an important mechanism with your everyday walking, standing, etc. So if your knee, the ligaments or the knee itself is injured or has some degenerative changes, and if your balance receptors are affected, you can also have issues with your balance. So the knee is actually a very important joint. So today I'm going to talk about the source of your knee pain. So I'm going to cover just two very common conditions. And I'll tell you about the rest later. But what happens is, why do you need to know what is the source of your knee pain? If you know where your knee pain is coming from, wouldn't that be great? Because the knee is so complicated. You want to know what actually is getting involved in the knee, right? So some of the symptoms of knee pain can give you an idea of what structures are involved. And once you have an idea of what structure may be potentially involved, you can discuss it with your healthcare provider, your doctor, or your physiotherapist, and they can assess your knee and then tell you exactly what is involved. And then basically, you have a better handle on your discussion or your contribution to your treatment plan, right? So it's always better. I feel personally that it's always better, and I have seen people who feel better and are able to cope up and manage better with their pain when they know why they have the pain that they have. Okay, so the first one that I'm going to jump into, sorry, just looking at my notes here. Yep. So let's look at osteoarthritis actually. So osteoarthritis of the knee is a degenerative process. So what that means is wear and tear of the knee joint. Now, we can not just dismiss it as saying, oh, it's just wear and tear. It can be quite painful. You can have a loss or a restriction of the range of motion. So basically, the amount of movement in your knee can be restricted. Most of the times, the inside of the knee joint, so if say this is your knee, so this is the outer side and this is the inner side. So this inside here, where when you bend your knee, so this line where you bend your knee, the inner part there is quite tender, because most of the times that is where your two bones are sitting quite close to each other. Okay, then you can have weakness in your quadriceps and your other muscles, but mainly your quadriceps. uh, the quadriceps is the main muscle that's controlling the knee, so you would see a lot of quadricep involvement in many of the knee problems, so especially so with osteoarthritis. When people move around, they can have a clicking sound in the knee. So it'll be like a crackling or grating sound, like a bone on bone grating sound in the knee. I actually know a 90-year-old lady who recently developed. I mean, she's 90, right? Her joints are really old, but thankfully, she's not very osteoporotic. So I have been seeing her for quite some time now. So she started getting this grating sound, which was like as if there's a creaky door around. And I was very surprised when I heard it the first time, because that's the first time I heard it that loud. And when I asked her, she said, "Yeah, it's coming from my knee. It's been there for the last 2 days." And I was like, wow, that is a lot of sound. But do you know what? When we did the exercises, now she's 90, okay? I'm not expecting a great recovery. We did a lot of exercises around her knee, did a lot of pain relief work around her knee, and the noise has actually gone down quite a fair bit. When she's walking, if I touch her knee on the inner side, I can still feel the grating under my hands. So yeah, that I just wanted to give you an example of, it can be quite extreme and painful, of course, as it was in this case, or it can be just painless, like, like clicking your fingers. So it can be just that tick tick tick, like a click of your fingers. So yeah, osteoarthritis, these are the general things you would find. However, everything that happens in your knee is not arthritis. There is something called a patellofemoral pain syndrome, or runner's knee. So, what happens is, in your knee joint, you have the kneecap, right? The kneecap is sitting inside the quadriceps. So, think about, if there's a cloth and there is like a solid, solid cup-like structure within the cloth, right? So that cloth is your quadricep, and that kneecap is sitting right inside it. Okay, so if you have a runner's knee, that is a patellofemoral pain syndrome. Patella is your kneecap, femur is the main thigh bone, and pain syndrome means you've got pain there. So if you have a PFP, as we call it in short, or runner's knee, if you have runner's knee, you will have pain in the front part of the knee. But if you actually sit down and think about it, the pain will be, if this is your kneecap sitting on top of your knee, the pain will be on behind the kneecap area, so on top of your thigh bone, underneath your kneecap. Okay, so that is a very typical symptom. And then, of course, there can be a bit of crepitus, that is like the clicking sound present. But then again, this clicking will be right under the kneecap. Some people can feel it when they're more aware of their body, some people can't figure it out, but of course your physiotherapist can tell you about it. Okay, so now they will have weakness in the quadriceps, but then when this weakness is present, is more so on the inner part of the quadriceps. So you might have noticed some of the elderly folks walking around with their knee slightly bent, so they cannot straighten out their knee completely. This happens when you have weakness, a lot of weakness, actually a lot of weakness in your inner part of your quadriceps. So the quadriceps, the name suggests quad, right? So it's got four parts. So the inner part of the quadriceps, when it is weak, it's called the VMO, in case you want to know. That's a part of the quads. If that is weak, you will not able to fully extend or straighten your knee. Now, this can be seen in runner's knee if it goes on for a very long time. But however, what I was getting at is, sorry, somebody's calling me. So what I meant to say is, there is um, the weakness in the inner quads. Okay, I lost my train of thought there. Yeah, so when you bend the knee, there can be pain right under the kneecap. Okay, now one typical thing that happens with runner's knee is, when the person is going uphill, or downhill, or running downhill, they will have pain behind that kneecap area, or in the front of the knee. So that is another typical symptom which you won't find in other knee pathologies. So Yeah, so those are the two quick ones that I wanted to cover today. However, there are lots of other knee issues that are quite common, and there are typical symptoms that are present. There can be a few overlapping symptoms, but there are some typical ones that are present in certain conditions. So if you know these, you will have a fairer idea of what's going on with your knee. I have these listed out. Obviously, I'm not going to talk about all of them here because they might not be relevant to you. If you want to have a look at them, you can grab the link, which I'll leave in the description. And for those of you who are watching me on IG, the link will be in the bio. It will say free guide and then what is the source of your knee pain. Okay, so alrighty, guys, if you have any questions for me, feel free to ask, but then grab your link there. It's a free guide. And yeah, if anything, let me know. If you're watching me on the replay, please comment hashtag replay so I know you've been here. If you're watching me on the YouTube, don't forget to like and subscribe.